Yes, I have. I have observed and experienced firsthand the myths, disparities, systemic inequalities, biases, and distorted perceptions around Black people's pain, as well as the treatment of sickle cell disease. I've been ignored and had my pain minimized. For an example, I actually sat in an emergency department's waiting room for a total of 6 hours in agonizing pain due to a sickle cell crisis. The ED was not crowded, yet it appeared that my pain was the last on everyone's list. So once I finally was seen, they gave me fluids and pain medication, which consisted of morphine. And then they wrote me a script to go home on Norco. So then I asked, would I be receiving a chest x-ray, which is pretty much standard of care for those who are experiencing a vaso-occlusive crisis, especially those saying that they have chest pain. And the doctor told me, oh, your lungs sounded clear, so you're free to go. And I ended up back in another emergency department the next morning because I still was in pain and nothing was working, even the Norco that they sent me home with. And I was for sure that I had pneumonia. And as soon as I walked into that next emergency room, they took me straight back there after triaging. They gave me an x-ray and then they gave me pain medication and fluids. And then once the x-ray and blood tests and everything came back, they found out that I did have pneumonia. So I immediately began antibiotic treatment and I was in the hospital for about 3 days. So for me, the access of care, as well as having properly trained staff, were the determining factors of my outcomes in this instance. Also, for me as a patient, as well as a provider, I was able to advocate for myself, whereas other sickle cell patients may not be able to do that. Now, I will give credit to where credit is due. A lot of sickle cell patients do know their bodies and they do know what works for them. But in terms of knowing, how we work up a sickle cell patient and, the treatments that we have for the complications that are due to the vaso-occlusive crisis, they may not be able to speak up for themselves in that manner. So that's where we as providers, it's important for us to be well educated and give time to actually treating our patients properly.